Hello and welcome to Health Talk. I'm Dr. Manny. We all know the dangers of smoking. But even if you never touched a cigarette in your life, a new study finds you may be exposed to those toxins without even realizing it. Joining me now is the chairman of the Department of Thoracic Surgery at the Mount Sinai Hospital and study author, Dr. Roger Flores. Thank you, Doc, for being here.
Thanks for having me.
I love your work. Full disclosure, Mount Sinai, my alma mater, I love it. But anyway, tell me about this new study. This is very interesting.
So it's an interesting study where we looked at 20,000 patients from the National Health and Nutrition Examination Survey, which is a CDC-sponsored study. And we looked at 20,000 non-smokers and measured cotinine levels in each of them. They're blood levels that measure whether or not you've been exposed to cigarette smoke. Cotinine is a metabolite of nicotine, and it goes up whenever you've had an exposure to secondhand smoke.
Right.
Now, the patients that we looked at in this study filled out surveys as well. And what's interesting is that a large number of them said that they had no exposure to secondhand smoke. But when you did this blood test, it showed that they actually were exposed. And we correlated it with the National Death Index. And we found that those patients who had an increase in this cotinine level in their blood were at a higher risk of death from lung cancer, from all cancers, and from cardiovascular disease.
So if they didn't smoke, if there was no immediate family member living with them that were smoking, where did the exposure come from?
And that's a good question, and it has a lot of health policy implications for it. The group that was disproportionately affected were children, minorities, individuals who rented their homes, and poor people.
Right. So it has a lot to do with where you live.
Close quarters.
It has a lot to do close quarters, right? So, you know, buildings, public housing, for instance.
Exactly.
It has a lot to do with socioeconomic status, minorities. And so where are we going? This is, I think, it's a very important discovery. I mean, we talk about secondhand smoke and the effects of it, but this has implication to at least have an open discussion about social policy here.
Absolutely. I think there has to be new measures to ensure that these innocent people are protected from smoke seeping in underneath the doors, through the walls, etc. It has implications if your cotinine level if it's high with regards to screening. Should these patients be followed in a CAT scan screening program so that if something does develop, it's caught early?
Do you know how expensive that is?
Extremely expensive.
So let me ask you a question, because, look, you're one of the leading authorities in the world on lung cancer and surgeon in one of the biggest medical school hospitals in the planet. When you talk about this among policymakers, when you talk about this with, let's say, fellow scientists, what's the bottom line? What would you like to see? Because, we doctors get a lot of flack, but, everything nowadays is about preventative health care. So what would you like to see?
Basically, I think we need to put measures in place that enforce keeping smokers isolated from those who are non-smokers. Now, we've already seen in New York the Bloomberg measures that I think have helped to a great degree.
Right.
No more smoking in bars and restaurants, etc. So that's a start. But we have to put those policies in place to protect those who can't protect themselves, like people from low-income families, people who live in housing projects, etc., minorities who are exposed to this without even realizing it.
This is the research that continues the conversation, and people have to realize that, smoking is something that, if you want to do it, it's at your own risk, but don't put others at risk. Doc, I love it. Give me where can we find this online, your study?
It's published in the journal Carcinogenesis. Right now, it's an e-publication. It should be in print within the next month.
Thank you so much for being here.
Thanks for
having me. You can read more about the study on foxnewshealth.com. And if you have a health topic you want to talk about, tweet me at Dr. Manny on Fox. Until next time, I'm Dr. Manny.